Hello, everyone. Uh, Autism is one of the most commonly found neurodevelopmental disorders today. Why is it commonly found? Was it not there previously? Interestingly, it was always there the way as it is today, more of it, if I can say. It was just that we, in terms of we as professionals, we also were not that very aware 2, 3 decades ago of what autism looks like. Like I remember in my internship in the pediatric posting, I don't think I saw too many cases of autism. But as the years progressed and as I progressed through my practice, I realized that these cases were there. It was just that I was not knowing, or possibly the professional out there was not that aware as we are all today. Okay. So it's like what you don't know, you can't see. And that is why I'm going to talk a little bit on how do you see autism in children, or what are the red flags? How do you identify it? First and foremost, if any of the pediatrician or developmental pediatrician or a general practitioner, if at all you're watching this particular video, I would want to just suggest something that the first time when a child comes to you after he's being born and you give that file to the child to maintain all his records, to the parents to maintain all the prescriptions and vaccination record, can we all also make a point to give a list of milestones of the children which the parents can keep a check on? A very mandatory thing, because the only way to identify autism or to see autism is by seeing whether our child is achieving the developmental milestones. Okay. And most of the parents are not aware of various developmental milestones. Like in India, again, we are more aware of physical milestones ki, गर्दन कब पकड़ने लगता है. So ठीक है, 5वें 6ठे महीने तक बच्चा गर्दन पकड़ने लगता है. Neck holding happens by 5th or 6th month. और चलने कब लगता है, या when the child starts to talk or when the child starts to run independently. So these physical milestones, the parents, we all are still aware of to some extent, but again, not in very details. Not in all strata of the communities that we have in India, all parents are that aware. Cosmopolitan cities, parents might be a little more aware, but you go to the interiors, the awareness levels of knowing even basic milestones is not there. So can we start having a practice where if a child is coming to us for the first time, just as we give vaccination record sheet, can we also give a milestone record sheet to the parents to keep a check on, and we educate the parents on the milestone aspect. When I talk of milestones, milestones are just not physical. We have to be aware and well informed about the emotional milestones, the social milestones, language milestones, and cognitive milestones. Okay, milestones are nothing but the steps that the child achieves when he is developing. Okay, if your child is achieving those steps or climbing those steps in the right frame of time, then we know that the child is developing very much normally. But if he doesn't achieve a particular milestone in a given range, that is the red flag. That is where we have to get aware that is my child possibly having a developmental issue of possibly autism nature. For example, when I talk of emotional milestone, you know, a mother came and told to me that the child was of 1 years old, and the child doesn't look and smile at her when she tries to smile at her, at him. Okay, so it's like when you do this to the babies, na ki, "Arey, kya kar raha hai tu?" A 6-month-old baby also should at least be able to change facial expression, look at you, and give a smiling expression. That is the very first step to know that the child is achieving his first emotional milestone. Okay, maintaining eye-to-eye contact, giving some sort of facial expression. Okay, similarly, we have other milestones, like for example, by 1 year old, whenever a child's name is called, the child should be able to quickly turn back and look at the person who is calling his name. But if that is not happening, that is another red signal that the child is not developed well on cognitive and emotional milestone. Similarly, a 1-year-old child, or by 12 to 14 months, whenever mama papa goes out, or the regular caretaker or the relative of the child goes away, the child should be able to wave tata. A simple thing, so waving tata. If that is not happening, that is a red flag. That happens usually by 12 months of age. So this way I can go on and on. There are so many milestones that we have. So it is always a great practice for all the parents out there who have the babies who are just born, or even toddlers or children, to get acquainted with these milestones. They are plentifully available on internet, and check if any of the milestones your child is not being able to achieve. See, it could be even one. ओके बाकी सब अच्छा कर रहा है बच्चा, लेकिन क्या है ना, 2 साल का हो गया लेकिन अभी तक मम्मा डाडा भी नहीं बुला रहे. इट कुड बी जस्ट वन, but it is an alarming sign. Go straight away to the professional and ask what this is. Neurodevelopmental disorders are not necessarily always autism. It could be something like social communication disorder. It could be some other thing that is happening, but we need to identify it right on time. Why is we need to identify it? See, remember, these are all very, very small signs that I just mentioned, and there are many more, which point us that child might be having autism. For example, lack of eye-to-eye contact, lack of pointing of fingers to show something, lack of waving bye-bye to the parents, the child not getting disturbed when somebody from the room moves away to another room. A 1-year-old child will start getting disturbed. All these are signs that social development, emotional development is in compromise, which is possibly going towards autism. So we need to be well versed with these milestones. And why it is important to be well versed? Because interestingly, autism can get diagnosed as early as when the child is just of 12 months age. Okay, or the risk for the child to develop full-fledged autism can be diagnosed as early as when the child is maybe 8 or 12 months of age. And if you can diagnose these issues that are starting to occur when they are in its infant stage, and you start the right interventions, high chance that the child will not later go into a full-fledged autism. Okay, so it is like preventing the autism to become a full-fledged problem, and that is very much possible, and that is very rewarding. So early the identification, earlier is going to be the intervention, earlier is going to be the intervention, maximum chances that your child tomorrow will develop almost like a normal child without having any major problems. So attaining milestones is one important way of identifying autism. Okay, understanding milestones and identifying if something goes wrong over there. And another thing which is somehow missed, or which many of us don't know that much, is that regression of milestones. Means what? Your child has developed certain skills, but then he suddenly stops using them. For example, my child, I had this particular parent coming in the OPD, and he said that 3 साल का मेरा बच्चा हुआ ना, तब तक सब कुछ सही था. वो मम्मा डाडा बात करता था, हमारे साथ खेलता था, या वो टाटा करता था, या हमारे आंखों में आंखें देखकर कुछ तो बात करने की कोशिश करता था, 2-3 वर्ड्स मिला के सेंटेंसेस बनाता था. लेकिन पता नहीं गए 6 महीने से बात ही नहीं कर रहा है. 2 वर्ड्स क्या, 1 वर्ड भी यूज करके ही इज नॉट टॉकिंग. He suddenly has stopped responding to the name, to his name. जब मैं उसको उसके नाम से बुलाता था ध्यान देता था, लेकिन अभी ध्यान ही नहीं देता है, बिल्कुल भी नहीं देता है, कोई भी कॉन्टेक्स्ट में नहीं देता है. So this is what I mean by regression of milestones. The child has achieved some sort of language, the child has achieved some sort of social interaction, but after achieving that, suddenly it went away. That also happens, and that is another red flag for autism. Regression of milestones. Please remember that. Okay. Once you feel that there are some sort of problems of this nature, the next question is whom to approach. Now, this will be a little tricky given the context that we have in India, the scenario that we have in India. Okay. More in the interior side of our country, you might visit immediately to the general practitioner to whom you are regularly visiting. Please tell him the concerns. Rarely it can happen that the general practitioner out there might just discard your concern, saying that nahi nahi theek hai, theek ho jayega. It can happen because, again, awareness. Okay, the awareness of autism amongst all health professionals may not be equal, specifically in interiors of India. Nobody to blame for that. That is just a fact that I'm trying to state out of experience. Okay, in that case, please take another opinion. Go to some other general practitioner or go to some other pediatrician if available in your area and try to identify if there is a problem. In cosmopolitan cities, you can directly go to your regular pediatrician, mention the concerns, or if you can identify someone called as developmental pediatrician who specializes in these set of developmental issues, you can directly approach to him, or you can identify a special needs center in your area, or you can also visit a psychiatrist or a neuropsychiatrist. They will assess your child further and they will then refer you to the right place if they sense a problem. So these are various points where you can visit if you find that there are some concerns in the way your child is developing and achieving the milestones. Okay, but remember to go out and tell. Do not take up the approach of wait and watch from your side as a parent. Okay, be very strict about monitoring the milestones of the child. It is usually said, कि क्या है ना, माँ है ना, वो ज्यादा टेंशन ले लेती है. Okay, at times parents or specifically mothers also get labeled that you are too much into your child. Okay, just give yourself a break and give child a break. But you know what, being a parent as well as professional and having some experience with autism, I would always suggest that even if you get labeled that you are an overprotective mother or an over involved mother, don't fall prey to those labels. You go and do the right thing of visiting a professional, even if you see smallest possible problem in the way your child is growing. Remember, I always say a parent knows the child best. So do go on your gut feeling if you feel that there is a problem. Okay. And take right help, because as it is always said in autism and rather all neurodevelopmental condition, is that early identification is the biggest key to unlock the minds of an autistic child and take him on the path of progress. So please do that.